Hello everyone, welcome to Oman. Welcome to Sultan Qaboos University College of Nursing. This particular discussion or this particular induction program is about the MSN program, which is very special and very young program in our College of Nursing. I am Dr. Eileen Lazarus. I am the MSN program coordinator. I am one of the MSN program coordinators. And this few slides I will explain what's happening in MSN program. We have started this MSN program in the year 2016. The whole Oman, Sultan Qaboos University is the first one they have started the Masters in Nursing. And mostly it was focusing on adult acute care specialty. The first cohort we have admitted about 5 students, but we have fixed in the annual intake about 5 to 7 per annum. But this we were running under the Department of Adult and Critical Care. Currently, we have 3 different MSN programs. We are so proud, and this is out of so many people's hard work. End of the day, today we have a lot of a different track of MSN program currently. As I mentioned to you, we have MSN Adult Acute Care. Now we have admitted the 5th cohort. As I mentioned, we have started in 2016. This is a 2 years full-time program. Then this year, 2020, we have started MSN Midwifery program. This is also 2 years full-time. Then one more MSN program, it is MSN by thesis. This particular program leads only thesis. This is also started in 2020. It is 1 year program full-time. So basically in our university, the different type of master programs. So based on that, we have a master's by thesis and master's by coursework and thesis. The master's by thesis, as I told you, it is 1 year full time. It is just 0 credit. The student will be asked to take 2 different courses. Mostly these courses will be the choice of that particular department. So here for the year 2020, we have started MSN by thesis at the Department of Fundamentals and Administration. So they offered the 2 different courses that I will explain to you later. Then another 2 track what we have here is the Masters by coursework and thesis, which is 2 years and full time again. Basically, the expectation out of Masters by coursework and thesis is minimum 24 to 30 credits of coursework they have to do and 6 credits of thesis. And the coursework, whatever the required in the coursework, they have to complete for the graduation according to the degree plan. And they must complete the thesis. The thesis can be of review literature, not necessarily it has to be adding a new knowledge to that, but still our students really, they are working hard and they are producing a very good thesis which won a lot of awards and in the GCC. And all the students, almost now around 9 out of 5 cohorts, we published around 9 papers in the Scopus. So the students can register the thesis course after completing 12 credits of coursework. The admission procedure, there are 2 different admission criteria. Mostly the admission starts by January until the process starts in January and it stays until September. We always start in the fall semesters. Any MSN program, always we start in the fall semester. So the criteria for 2 years program, minimum CGPA, the cumulative GPA must be 2.75 to 2.99 in case of 2 years of experience. The CGPA with 3, if with less years of experience, less than 2 years of experience. The IELTS of 6 core is must. Then there must be a release letter from the employer for Omani in case if they are working in a government sector, we need to have a release letter to admit them in this program. If the student is unemployed, they have to get the certificate from the human employment office from the government if it is self-funded. So we are accepting international students also. This year 2020 we interviewed about 30 application in adult acute and 29 application in midwifery and 15 application in MSN by thesis. But midwifery and adult acute, we had about 3 to 4 international students. We have selected, but due to the COVID situation, we couldn't admit them. But for the international, there is no release letter, but all other criteria will be the same. The criteria for MSN by thesis, that is 1 year program, the CGPA should be 3, and they have to have a postgraduate diploma degree in nursing with the background of nursing. The program objective, it is mostly the management of adult acute and pregnancy related health problems and research utilization for evidence-based practice, health promotion for the individuals, families and group from different population, then comprehensive advanced nursing care and cultural competence and advocacy in the ethical delivery of care to the vulnerable populations, and to participate in the development of nursing knowledge through research and application of research findings. Then it serves as a leader, mentor and change agent wherever they are from and from the clinical practice, and design and implement innovative solutions using research, education and clinical leadership needs. Collaboration with healthcare teams to advance healthcare individuals, families, groups and the populations within the system. The line of communication in postgraduate studies, mostly the student or the faculty, when they are there admitted or when we are working with the postgraduate track, mostly the students will be communicating to the course coordinator, and the course coordinator can communicate anything related to the program with the program coordinator. Actually, the program coordinator is the liaison between the students and the course coordinator, HOD, and the assistant dean for postgraduate studies. The HOD in turn, anything he will be decentralizing from the department board. Then from the department board, we inform to the assistant dean for postgraduate studies of the College of Nursing. Any issues or any amendments will be discussed in the postgraduate studies committee, which is the governing body and this is the one regulates and monitors the program of that for each college. And ultimately it goes to the dean, from the dean it goes to college board, and from the college board it goes to deanship of postgraduate studies and to the academic council. This is the line of communication within the postgraduate studies. The Postgraduate Studies Committee, as I mentioned to you, it is one of the standard committees of College of Nursing. It controls and governs the MSN program based on the Sultan Qaboos University postgraduate regulations, academic regulation. We have released the recent academic regulation in the year 2018, which is there in the slide. Later on, you can just follow the link to log on to these regulations and you can go through that. Assistant Dean for Postgraduate Studies will be the chair of this committee, and by default all the program coordinators will be the members of the committee, and those who are interested and apted for this particular committee, they can come in. Mostly all PhDs will be there in this committee. Assistant Dean's Postgraduate Studies Office, who are there in that office? These are the people, they work closer along with the HODs of respective department. As I mentioned to you, I'm happy to introduce the Assistant Dean for Postgraduate Studies, Dr. Sulaiman Al-Sabi. He is the Assistant Dean for Postgraduate Studies and Research, and he is he's in Department of Fundamentals and Administration. And under him, there are 3 different program coordinators we are working. I myself, Dr. Eileen Lazarus, I'm assistant professor from Department of Adult Health and Acute and Critical Care. And we have a program which is the very oldest program. We are the one first started the program in the year 2016, and the next one is it's a 2 years program. The next program coordinator, Dr. Vidya Seshan, and she is the program coordinator for midwifery. And Dr. Gerald, and he's assistant professor. He's from Fundamentals of Nursing department, and they are the one started the MSN by thesis. So we, four of us, we work together, but we liaison between the head of the department and the assistant dean for postgraduate studies. Who is this program coordinators? Let me define for you. A member of the department faculty who coordinates all matters related to the program's requirement and student advising. So each program coordinator, they will have a coordinator who will help you. What is their important role? Their important role is to orient the master students to the postgraduate academic regulation, and they'll be involved in advising. They are the academic advisors, and they will be supervising the student, and they will be following the students based on the degree plan. As soon as they got admitted in the program, they will go and meet the program coordinator. They will secure their own study plan, and from that time onwards, they will be having close relationship with the program coordinator, academic relationship, and that will go until their successful graduation. So the program coordinator monitors every semester on their GPA and their the other academic performance, and the relationship with course coordinators and with the thesis supervisors, and they will be available for a specific period of time for advising. This is the example of a study plan. Then this is the study plan of adult acute care. You can just go through that. But before I start explaining this, let me tell you how we are structuring, or we have structured this master's program. As I mentioned to you, there are two. One is 2 years program. The other one is the 1 year program. Let us not talk about the 1 year program. The 2 years program, we have a track. Initially, for some time, they'll be taking core courses. As soon as they are admitted, all the master students are expected, those who are in 2 years track, are expected to undergo a core course. The core courses are nothing but advanced health assessment, advanced pathophysiology, advanced pharmacology, and advanced nursing research process and evidence-based practice, and health promotion in advanced nursing practice, and any one of the electives. So these are the core courses, or all students, irrespective of their specialty, they will be under the same roof, and they will be taking the classes. Say for example, if they come to a health assessment, so all midwifery and adult acute care students will be sitting in the same class. Focus will be given to the adult health assessment, plus 20% of focus will be given to the normal variations in the pregnancy. So the ultimate thing is they are also studying the midwifery, so they are also adult. So to enhance their knowledge, they will be learning along with along with adult acute students, but all these things are core courses. These core courses, especially the 3 Ps like physical assessment, pathophysiology, pharmacology, this is under the adult department. Then after that, they will be taking their own specialty and the master's thesis. So this is about the study plan. So the study plan will be stretched for 2 years. As I mentioned to you, we always start in the fall semester, and then they go to the spring semester. If they want to register the thesis course, they are expected to complete 12 credits of coursework. After that, they are eligible to register the thesis course at any time. Then they will be going to the next fall semester, and the last spring semester will be their defense. So this is the sample of midwifery study plan, and you can see again in the first semester they take their core courses, then they take their specialty, and then there will be any one of the elective course. We have elective course like organization and systems leadership in health, theories in nursing, independent study, teaching and learning in nursing, roles and advanced nursing practice. So they take all the students, they select one as an elective. This is the recommendation. One elective can be taken. This is the study plan for the MSN by thesis. As I told you, this is 1 year program. They'll also start in the fall semester. So there is no summer. Any of the master program, there is no summer for them. So they will, as I told you before, this is thesis leading course. Along with thesis, they will be taking 2 different other coursework that will be recommended by the particular department. This particular course belongs to Fundamentals and Administration Department. They are offering Advanced Epidemiology and Biostatistics and Advanced Nursing Research Process and Advanced and Evidence-Based Practice. So they will be taking this particular course, but for 0 credit. So progression of standards in coursework. This is the typical role of program coordinator. As I mentioned to you, how do you know that they are progressing well? You have to have a cumulative GPA of 3. And if you go to the academic regulation, it is mentioned in section 10 and 11. If the student is falling below this 3, then they will be placed in under probation. They will be given 1 semester, excluding the summer. Within this 1 semester, they have to regain and minimum standard, at is minimum of 3, and they have to come out of the probation. Especially when you are in after registering thesis, you are supposed to maintain 3. Or throughout the program, we expect this master students to maintain 3 the GPA. Then MSN by thesis, how do they do? They start the program or the formulation of a thesis committee once they complete the 12 credits of coursework. Then after that, they will proceed with their proposal for approval of research ethics committee. Then meantime, they have to do a seminar. Before they proceed to data collection, they have to do the first seminar. This is the mandatory by the PG postgraduate regulation. Here the seminar will be public. The first seminar will be focusing on the background, the objective and the study design, and the first 3 chapters will be discussed in the for seminar 1. Then the student will be going into the data collection and analysis, and seminar 2 will be presented, and that is also public. Then after that, the student is ready to go for defense. So to qualify themselves to go for defense, they have to complete successfully 2 seminars. Then after that, with the 3 GPA, they will be preparing themselves for the thesis defense. And thesis defense, it is no matter public, it is in a private, only to the thesis examination committee. So thesis supervision, there is a group of members they will be having in the thesis committee or thesis supervision committee. There will be supervisor, it's a faculty, it's he will be supervising from there. The supervisor, most probably they will be from the same department with the PhD qualification who is active in research. And the co-supervisor is also a faculty member and non-academic staff who contributes towards the supervision of students during their thesis work. This is the one forming the thesis committee. The thesis committee consists of supervisors and the chair and the co-supervisors and 1 or 2 more faculty, doctoral faculty to guide the thesis successfully. So MSN thesis defense, when does it happen? So it happened this will be initiated in the graduation semester, mostly in the spring semester. Then student, they have to have a 3 GPA, and the student would have should they have to complete two required seminar, as I mentioned to you. The thesis committee should confirm that they are ready for the defense, and the department should nominate the thesis examining committee. The thesis examining committee consists of 4 people. The chair, he is a non-voting member from the outside the department, students department. And the supervisor, of course, the student's thesis supervisor. The internal examiner will be nominated by the head of the department or the HOD himself or herself. The external examiner, it's one external examiner for the master program, or 2 for the doctoral program from the outside the students department or even outside the country. Preferably those who can come and those who can conduct the thesis face to face. And the supervisor, internal examiner, external examiner will be the voting members. The student will be categorized into different category based on the voting. But the chair will be having the full control of the thesis examination, but he is a non-voting member. Most probably they are mostly an associate cadre. So the external examiner selection, senior nurse with PhD, willing to provide a professional CV, active in research and teaching as evidence by the CV, willing to read the thesis and provide a preliminary report before traveling to Muscat, willing to travel to Muscat to conduct the examination. The thesis examination committee responsibility, they review the thesis forms. Each voting committee member have to have a comment over the thesis and using the thesis form prior to the oral defense. Then they will come and conduct the oral defense according to the postgraduate academic regulation. The chair prepares the report or summarize all the report. Then based on the majority vote, the student will be placed into 3 different categories, and within 1 week after the defense, the result will be sent to the Deanship of Postgraduate Studies. So this is the defense process. There will be preliminary session for 20 minutes, thesis presentation not less than 30 minutes. There will be a question session by the committee. There will be a decision, and the defense report will be compiled and submission of the final report. As I mentioned to you, SQ does not require or recommend public defense. So after the defense, the decision, as I mentioned to you, they work for 6 credits, this particular course, thesis course. They deserve for A to F. So A grade, B or C grade, and F grade. There is no D grade. So there will be a pass, and there will be a pass pending minor revision, and deferred pending major revisions, and there's no pass. So these are the different categories they will go with. The pass pending minor revision, they can do it, it's doable. They will be graduating by successful submission of the revisions. Deferred pending major revisions and no pass will be given second chance after 3 months after the rectifications. If they don't come out successfully, there will not be any other chance given to the students. The student will be dropped from the program. Thank you very much for listening to this presentation. If you have any doubt or if you need any clarification, feel free to text us, and we are ready to clarify your doubts. Have a good day.